Hello, hello. So I'm here again to record the second day, the second section of this lactation book and my dogged pursuit to get through this book and hold myself accountable. Shout out to Dee Dee Hair Braiding in Newark. I love them because they open at 5:30 a.m. and I'm able to go in first thing in the morning and get my hair done. So later on, we have to go. Me and my daughter, we've got to go to um, a party out in Long Island, and this was the only time that I could do it. So I got my hair twisted, some butterfly twist, and a little boho thing. It's cute, simple, fast. So yeah, today, so I don't have a lot of time for self-care this morning after I came back from doing the my hair. I had to teach a course for new doulas that are enrolling in New Jersey FamilyCare. There is a push to enroll these doulas, but with my training, I have a little bit of a different approach in that I want them to understand the implications of, you're not just a private doula, you're becoming a Medicaid doula, and you're going in from a system of, or an understanding of community care and whole care to a system that is really not built on whole care. So I used to teach this course like straight up, like this is what you need to do. This is all the things that you need to have, and this is uh, like these are all the steps. This is the packet. Email it. Blah blah blah. And I was like, you know what? Let me take a step back. I've been a doula for 8 years. I've been doing the Medicaid since 2022, 2021, and when it became law. And I need to teach folks and share with folks the reality of what it is to become a Medicaid doula. There is you get a lot of calls, you get a lot of people that maybe you shouldn't take on, because when you're a new doula, you're excited to take on everyone. And actually, what I tell doulas is that you actually should not take everyone. You really need to do a thorough intake process, and you need to understand the type of family, understand what they need, and understand if this is something that you can take on. Do you have the resources to do that? And then also recognizing that you can't take a bunch of families a month. You really should be, as a new doula, you really should be maybe taking 2 births max a month. And people don't, like, that's kind of shocking because some folks want to take all the births, and it's like you got to think about when families are delivering, and the space in between that, and anything can happen. Some families can deliver way early, and so you're going to be kind of going crazy because you won't have that downtown time to really assess and kind of reflect, and also give yourself some self-care. So that aside, speaking of self-care, I'm not going to do a full-on face thing because I did most of my stuff this morning, but I am going to do this under eye mask. So this is from Topicals, and I really like it because it's a brightening and clearing eye mask. I haven't used it in a while, and so I'm going to take this opportunity to put them on just because they're really cute, and also they do help. So, and I want to look fresh for this event, just because I've been working. I've been up since 5, actually since 4:30. Taught a class, got my hair done, taught a class. I took a little bit of a nap. I've got to go and twist my daughter's locks for the party, and it's a lot. I'm always, if anybody asks me like, "What are you doing, Tatiana?" Usually the answer is too much. So I've got this on. I'm about to put on a patch. So I use these. They're called the Good Patch. I use these not every day, but lots of days when I know that I've got a lot going on, and I'm a little exhausted and I can't go to sleep. Unfortunately, the right answer to this is you're supposed to go to sleep, but I can't go to sleep. This is an RSVP party. I've got to go, and I've got obligations. So this is just a little patch that I put on, and this lasts me about 12 hours. It gives me a little zing, and helps keep me going. And I've got my water. Yes, got my water because it is 80 degrees outside, even though it's rainy, and I've got to stay hydrated. I've got my Topicals lip balm, which I'm going to use the camera to do. My lip balm. I like this lip balm because it's actually super sticky and it lasts long. So, yeah. So today, I might come back again this evening to do more sections, but I just want to, in the spirit of continuity, I'm going to keep it on, and getting through this book. So I'm reading the Pocket Guide for Lactation Management by Karen Cadwell and Cindy Turner Maffei, and I'm currently on section 2, How We Approach Lactation Counseling. Together with our colleagues at Healthy Children's Project Center for Breastfeeding, we have developed a credo defining our approach, which we share below. Our approach is to observe, explore, and coach. We believe that the parents, baby, and other family members know more about their situation and resources than we do. It is our job to observe, collect information, and explore the nature of presenting issues, and to coach families regarding feeding and nurturing their babies. As we seek to understand the nature of the presenting issues, other problems and concerns may be uncovered. In our conceptual framework, which is in Appendix A, problems and symptoms are not the same thing. For example, pain with feeding is a symptom of a different problem, perhaps a poor latch. Through breastfeeding counseling, we seek to identify the true nature of the underlying problems rather than only removing the presenting symptoms. I just had a family that I use some of these principles just because folks are so used to pain when they have the baby, when they do that first latch. This was the second time, and she just assumed that it's going to take a while, it's going to be painful. And I told her, actually, no, it's not supposed to be painful. And I walked her through all the steps that I was taught in latching so that she could get a good latch, like nose to nipple, tummy to mummy, as they teach in this group, and things like that, and just making sure that the alignment is correct so that you are getting a latch. And once we did that, then it was like there was no pain. And she was like, wow, oh, that's how it's supposed to feel. I'm like, yeah, that's how it's supposed to feel. So the last bullet point, once we have gathered enough information about the nature of the problems at hand, we can formulate a potential solutions and propose them to the family. It is up to the family to then choose the solutions they are willing to implement and to carry them out. It is our responsibility to provide information and suggestions in an open, transparent, and non-judgmental manner, identifying strategies that may be useful for the family, sharing pros and cons of identified strategies, all in full acknowledgement that the family will make the final determination regarding what actions to take, if any, to address identified challenges. It is our responsibility to refer families for additional clinical support or other evaluation as needed if it is not available at our workplace or within our scope of practice. It is our responsibility to ensure adequate follow-up for identified breastfeeding problems. This is important too, because one of the things that I was telling the doulas this morning during the session is that you need to have that circle or group of resources to refer out. You're not going to have the answers for anything, and also you need to consider your scope of practice as a doula. If you're a doula, you're not a clinician. You don't need to do all the extra things that somebody else outside of your scope of practice does. You need to remain within your scope of practice and refer out for something that you are not able to handle. And have confidence. Know that you're doing the right thing. A person who is really confident in their skill set and what they know, they are confident enough to refer to someone else for support and have their client go to someone else. What we expect to see: horses, zebras, and unicorns. It is our expectation that nursing will be a joyful and pleasurable experience, and also that the baby will thrive and grow on the milk. We also expect that breastfeeding will happen in an environment that supports the feeding choice. In other words, we expect to see breastfeeding as normal, common, and fulfilling for both nurser and nursling. When we see deviations from these expectations, we must be able to assess whether the deviations can be corrected by changing breastfeeding management practices or not. We think of these issues as horses, zebras, and unicorns. They all have similarities, and at first glance, or from a distance, or without sufficient education or skill, we may not be able to tell the difference between a horse, a zebra, and a unicorn. Let me just continue reading, and then I'll tell you about my doula's perspective about horses, zebras, and unicorns, and why in every instance everything seems to be a unicorn. We think of horse issues as those that are fairly common and managed by changing breastfeeding practices. This book is filled with issues that are on the horse level. These are often seen everyday breastfeeding issues for which we have written unique identifiers in the text. We have offered suggestions on what else to think about if our techniques don't work. Perhaps the technique doesn't work because the problem presents at the horse level, but is actually a zebra or a unicorn level issue. Example 1. A lump has been located in the breast and there is no fever or other systemic symptoms. There is a small area of redness observed near the lump that is slightly tender when touched. We offer breastfeeding management strategies with the expectation that the lump will move down and disappear in 24 to 48 hours. So, our expectation is that the lump is at the horse level of the issue, plug duck. If, after 48 hours, the lump has not moved with frequent feedings, we move to the zebra level, galactocele. This requires closer scrutiny, imaging the lump, and needle aspiration of its contents. For example, if milk is not aspirated, the lump may be at the unicorn level, breast cancer. Example 2. There is a reddened area of skin on the breast along with feelings of illness and even an elevated temperature indicating a fever. Our expectation is that the issue is at the horse level, mastitis. If after treatment with anti-inflammatory drugs and antibiotics, the area of her breast is still affected, the issue could be at the zebra level. Recurrent mastitis with an underlying factor such as anemia. Further investigation may reveal that the issue is at the unicorn level, inflammatory breast cancer. Unfortunately, we have known cases where inflammatory breast cancer went undiagnosed for far too long because caregivers clung to the belief that breast inflammation when breastfeeding must be mastitis. Example 3. What about a pus-filled area on the areola? Horse level of the issue is infected hair follicle. Zebra level is infected Montgomery gland. Unicorn level, herpes, can be fatal to newborns. Sometimes it is hard for caregivers to remember that breastfeeding is the normal, healthy way to feed babies. This is especially difficult if caregivers have seen a few zebra or unicorn issues recently. It takes a lot of effort to think on the horse level again. Or sometimes caregivers are working in a high-risk situation and every breastfeeding issue seems to be a unicorn. This scenario can produce unnecessary stress for clinicians and the families they serve. However, it is easy for caregivers to believe that breastfeeding is so healthy for both members of the dyad and that breast milk is so good for babies that they stay too long at the horse level instead of moving on to other rarer possibilities, zebras and unicorns. Unfortunately, over the years, we have had occasion to observe the sad consequences of this kind of thinking. Thus, we seek to understand what the normal breastfeeding experience is so that we can identify symptoms and situations that require deeper exploration. We explore the normal experience of breastfeeding in section 3. So, from a doula's perspective, everything, and when you're working in these hospitals, and especially when you're working with Medicaid families, everything is a zebra. Everything is a zebra. At 37 weeks, everybody's baby's large. Everybody needs to be induced. Everything is a zebra. Why? Why is that? It drives me up the wall because all it does is it brings anxiety to families. It makes the moms worried. It introduces a level of anxiety that it doesn't help the situation. And it can't possibly be that everybody is a zebra. And I feel like in the medical field, there is this push to make everything a zebra, and then to offer more interventions, and then those interventions lead to more interventions and more anxiety, and then you got a mom with high blood pressure, and have they stopped to think that maybe all of these appointments, these extra appointments on top of appointments, all of this anxiety thrown on the mom, that is not the root of their anxiety, and adding in all the other social determinants of health. Like, let's take a step back here, and let's see like how much the medical system is contributing to these adverse factors. Everything is not a zebra. Let me know in the comments if you experience this as a doula. I know that you do, and especially with our moms that are in our urban areas. I'm in Jersey City. I've worked in Newark a lot. Everybody's a zebra. Everybody is not a zebra. So that's the end of section 2. It was a quick session. I might go into section 3. Section 3 is a little bit long, and I want to be able to actually do the whole section in one sitting so that this is organized, because I told you at the beginning in the last video, I selfishly did this for me so that I can go back and listen to my recordings and kind of digest the data in this way. And I need it to be a little bit sectioned off so that like I'm prepared for the content. So that's the end of section 3. Thank you for joining me. Hope this was helpful. I have the links to the book and the products that I use in the description, and I hope you have an amazing day.